Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurophysician from Rajahmundry, Andhra Pradesh, India. Today we are going to talk about headache, part 1, International Classification of Headache. There are going to be 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Right now we are on Prime Neurology part 18, Headache part 1, International Classification of Headache. Headache and migraine. Headache is a symptom of pain anywhere in the region of the head or neck. There are more than 200 types of headaches. Some are harmless and some are life-threatening. Headache is among the most common reasons patients seek medical attention on a global basis, being responsible for more disability than any other neurologic problem. The International Classification of Headache Disorders characterizes headache as primary or secondary. Primary headaches are those in which headache and its associated features are the disorder itself. They are benign, recurrent headaches not caused by underlying disease or structural problems. Example, tension type headache or migraine. What are secondary headaches? Secondary headaches are those caused by an exogenous disorder. They are caused by underlying diseases like an infection, brain bleed or tumors. Secondary headaches may be dangerous. So this is the International Classification of Headache Disorders, ICHD 3 beta version. So it can be divided as primary headaches and secondary headaches. Primary headaches are migraine, tension type headache, trigeminal autonomic cephalgias and other primary headaches. Secondary headaches are headaches attributed to trauma or injury to the head and or neck, headache attributed to cranial or cervical vascular disorder, headache attributed to non-vascular intracranial disorder, headache attributed to a substance or its withdrawal, headache attributed to infection like meningitis, headache attributed to disorder of homeostasis, headache or facial pain attributed to the disorder of the cranium, neck, eye, ears, nose, sinuses like sinusitis, teeth, mouth or other facial or cervical structures, and headache attributed to psychiatric disorders. So this is the classification of the International Classification of Headache Disorders. So we have primary headaches, secondary headaches, and then part 3 is painful cranial neuropathies, other facial pains and other headaches, painful cranial neuropathies and other facial pains and other headache disorders. But how to find out whether the headache is dangerous, like a secondary headache or it's a primary headache? The American Headache Society recommends using SNOOP, S-S-N-O-O-P, and mnemonic to remember the red flags for identifying a secondary headache. As I said, secondary headaches are dangerous. Primary headache isn't dangerous at all. They are benign, a recurrent type of headache, and they are harmless, like migraine, tension type headache, autonomic cephalgias or other primary headaches. But secondary headaches are dangerous. They may be having an underlying disorder. So how to identify the red flags for identifying a secondary disorder? So the American Headache Society recommends using SNOOP and mnemonic to remember the red flags for identifying a secondary headache. They are S-S-N-O-O-P. What are they? So we have 2S, N-O-O-P. The 2S stands for 1. Systemic symptoms, secondary risk factors. Example, if they have fever, weight loss or fatigue. Then you have to think of infections, inflammation, metastatic cancer or carcinomatous meningitis. N, N stands for neurologic symptoms or signs. Example, altered consciousness or focal deficits. Think of encephalitis, mass lesion or stroke. O stands for onset. So if it is sudden in onset, you think of thunderclap or abrupt headache. We have to think of subarachnoid hemorrhage or intracerebral hemorrhage or RCVS. Another O is for older. That means patient is older and age is after 50 years. So if the new onset of headache after age 50 years, we have to think of temporal arteritis. P is for positional, prior history of headache, papilledema. Positional, change in upright position versus lying down. Then we have to think of intracranial hypotension or intracranial hypertension. Prior of history of headache, but it's a different in quality. It could be a dangerous headache. Papilledema, if there are visual obscurations, you have to think of posterior fossa pathology. So these are the red flags to identify a secondary headache. Headache, clinical approach. The brain itself is not sensitive to pain because it lacks pain receptors. You cut brain, there is no pain. However, several areas of the head and neck do have pain receptors and can thus cause and sense pain. These include meninges, vessels, cranial and spinal nerves, head and neck muscles. Meninges and vessels are pain sensitive structures. That's why when meninges are affected, we get headache. For example, meningitis. When there is infection of meninges, they present with severe headache. Subarachnoid hemorrhage. Because of the blood products, a chemical irritation of meninges also can have severe headache. Migraine, trigeminal meningovascular system getting affected. So they also will have headache. So whenever meninges gets affected, they'll have severe headache. So these include meninges, vessels, cranial and spinal nerves, head and neck muscles. Headaches often result from traction to or irritation of the meninges and blood vessels. So these are the wonderful concepts of the international classification of headache. I hope you have enjoyed listening to these wonderful concepts of the international classification of headache. The other important concepts of clinical neurology I put in a book called Exam Oriented Clinical Neurology, published by White Army. If interested, this book could be purchased. This book will be very useful for students appearing for clinical neurology exam. The other book I've written is Focused Neurology. It contains all the theoretical neurology in a question and answer format, published by CBS publishers and distributors. It will be very useful for students appearing for theory neurology exams. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. As I said in the beginning of my lecture, there are 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. I have just finished another episode of Prime Neurology, so I just suggest to listen to all these 50 episodes of Prime Neurology. If you have enjoyed listening to this video, please share, like and subscribe to my YouTube channel. But please subscribe to my YouTube channel, Dr.Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.